you, and good afternoon to everyone. Thank you for joining today's session on Are We Ready for the Future of Healthcare? So this year has been a very interesting year for the healthcare sector with the COVID pandemic impacting it globally, and a lot of people's life has changed before and now in this pandemic. And healthcare sector has been evolving to adapt all these changes. So today I'm honored to be the moderator, and I want to also thank you, our distinguished panels, in together with us to share and discuss what are the things that is before the COVID and now within the COVID situation. And some of the topics will include such as like healthcare innovations and technologies, evolving use case to patient experience, aging population, next big investment and growth opportunity, and then at last, risk over valuation and fundraising. So maybe I can just quickly by introducing myself. My name is Toto Koo. I head up the Greater China region for data science. And data science, we are the VDR that facilitate the due diligence process within financial transactions. We do close to 1/4 of the M&A transactions globally, and we do more than 10,000 transactions per year. So if I can firstly introduce the panel. So today I'm delighted to introduce Professor Brian Kennedy, which is from National Universities of Singapore, and Dr. Sabrin Yamenyam Yadavili. He's the CEO of Apollo Hospital, and Daniel Leverage from Sulik Pharma. He's the head of SAP and IT solutions. Das who is the chief business and investment officer of Livingston Health, and at last, Wei-Meng Lim, which is the founder and CEO of Dr. Anywhere. So possibly I'll just give a short minute for each of the panelists to maybe a short introduction for each of you.
I guess I was first to be introduced, so I'll start. I'm Brian Kennedy. I'm a professor at biochemistry and physiology at National University of Singapore, and I'm directing a new Center for Healthy Longevity, where we try to think of strategies to target aging, which is the biggest risk factor for almost all of the chronic diseases we worry about, and also the severity of COVID-19 as well. So we're trying to move medicine a little bit more toward a preventative mechanism by targeting aging itself.
Mr. Toto, can I go ahead? I think I'm in the second in your list.
Yes, please. Okay.
Okay. Good afternoon to everyone. I'm deeply honored to be a panelist in this forum. Thank you so much, Mr. Toto, by introducing me for this panel. And my apologies that I have a very, very complicated name for pronouncing. So my name is Subramaniam Yedavalli. So Indian names are, slightly difficult to pronounce, I understand. And I have a very, very complicated name. So my name is Subramaniam Yedavalli. I'm the regional CEO for Apollo Hospitals Group. I operate from Hyderabad, which is in India. I take care of about 2,000 beds, almost all, about 5 hospitals and 1 medical college and other. I run a health city here. So I have been with the medical administration, the community, for the last 38 years. So this is, briefly my introduction. Maybe when we are talking, when Mr. Toto asked me some questions, probably I'll try my level best to answer in whichever way we can contribute to the system. Thank you so much, Mr. Toto.
Thank you, Doctor. Off maybe next to Daniel.
Yeah, thanks so much. My name is Daniel Levick. It's great to be on the panel. I head up SAP and IT solutions for Zulik Pharma. So today really was to give a bit of an insight of what we're doing in Zulu Pharma as one of the largest distributors of pharmaceuticals in Asia, how we've had to really kind of pivot our digital solutions when you're at the forefront of kind of the COVID pandemic, and really just to give an insight of some of the things we've seen happening in the industry, and what we've kind of done to try and make sure that we can keep on shipping products to people and making healthcare accessible. Thank you.
Thank you, Daniel. Off to Dax.
Good afternoon, everybody. It's a pleasure to be on the panel with titans of health in different parts of the value chain. For Livingstone Health, we can give insights from a small and medium enterprise group in Singapore, multidisciplinary. We have been growing through the years, facing COVID, and how our business has actually pivoted to that period. So for us, we have a group of practitioners ranging from orthopedic all the way down to family medicine and aesthetics. We try to grow within Singapore and capture that value base, but at the same time, we are very aware of what's going on, and we try to sprout a second wing, very much like how Singapore advocates, and we try to have a footprint out of Singapore over time. So pleasure to be here.
Thank you, Dax. And off to Wei Meng.
Hi everyone. My name is Waiman. Lim is my family name. I'm the founder CEO of Dr. Anywhere. We are a Singapore-based, Singapore headquartered, Singapore-founded telehealth company. Vision is to be, omni-channel, health-enabled healthcare service provider in Asia. Today we are in Singapore, Vietnam, Thailand, Malaysia, as well as in the Philippines, right? What we do is we provide online, offline health services to our users within these countries. So we are a healthcare service provider. Thank you very much.
Thank you, Wemong. Great. So before kicking start off into the questions, I would just like to share some of the statistics that we have. So just to give the ground of for planting for the preparing the questions. So we at Data Science, since we do more than 10,000 transactions per year, so we look at this more healthcare from a holistic point of view. So some interesting figures to share. So within the whole APAC transaction breakdown, 7% of them are healthcare related, and the deal volume have increased by 5% year to year. Okay, and specifically in the third quarter, it has been a record month. We had more than 400 transactions within APAC region, more than 33% growth compared to previous quarter. And specifically in the Greater China region, since I'm responsible for Greater China, so I have a little bit more stats on that side. So IPO have actually tripled from previous year in terms of healthcare listings. Deal value have increased by 50% plus. And within the sectors, the top sectors, actually healthcare has grown to number 2 within all in terms of the deal volumes within the Greater China region. So we do see healthcare has been growing, and I think this is not only because of this year, because of the pandemic, but actually even before last year, when some of the listing requirements, such as like in Hong Kong Stock Exchange, the Chapter 18A, which have actually attract a lot of investors coming investing into this industry specific. And I would like to go to a little bit more of the subsector side. So within the subsector, we see there are 3 sectors that are growing in particular: pharmaceutical, healthcare equipment and supplies, biotechnologies, and there are 2 sectors that are slightly decreasing: hospitals, healthcare providers, and services. And I'm sure with these, all the panelists can share their views on this afterwards. Furthermore, in terms of country breakdown, close to 50% of transactions of healthcare are actually related to Greater China, as from the Greater China region. Southeast Asia accounts around 15%. Japan and Korea each accounts around 10%, and the remaining for the others. All right. So maybe since I've been going through some numbers and particularly in the financial transaction side, I may want to just firstly kickstart the question possibly on fundraising and valuation. So maybe Wei Meng, since congratulations in actually in the successful Series B fundraising just earlier this year. Maybe you can share some lights on the, I mean, how was that process, and in terms of like fundraising and also on the valuation side of it.
Yeah, sure. Not sure if I can share the details, right? But the process started sometimes towards the end of last year. You know, a lot of people thought that the Series B shareholders were, got in at the right time, so on and so forth. While it's true, when we announced our Series B fundraising, that was in 31st of March, I remember, right, this year. So it was a few days later, and then there was a lockdown in Singapore, and everyone was like, wow, you know, these investors, they really got in the right timing. But truth is that no, right, they got in, we started the conversation much earlier, even before COVID was, widespread like now, right? Our investors were who led Series B was SquarePeg. SquarePeg is Australia's one of the largest VC. We also have EBBI, the government of Singapore. Also IHH. IHH is this a local brand name or Asia brand name that you know, right? They own Parkway, Pantai, and also many other hospitals in Middle East and so forth. And we also have Pavilion Capital, who also joined part of the investor group. So that in terms of valuation, I think I would say that the valuation comes in two forms, right? Ultimately, I think you still need the numbers to show, right? And also then the story, the sector, the thematic of the sector, and ultimately giving you that multiple, right? I would say that since the lockdown started, pretty much in a whole world manner, telehealth as a sector has, if you look at the listed comps, right, like your Ali Health, Ping An Good Doctor, in the US you have Teladoc, and you have like JD Health, so on and so forth. All of them, they have gone up from like your 10 to 15x revenue to right now. I think they're trading at about 25x, right? So you can see a significant uplift in terms of multiples on the revenue. But obviously there are, in Southeast Asia, some other platforms, I would say that still, still quite early days in terms of monetizing, right? So some of the multiples are also perhaps, I'm not sure if it's relevant right now to talk about it. Yeah.
Got you. So I bet your investors must be happy now.
Sorry?
Wonderful. I bet your investors must be happy now.
Yeah.
Anyway, maybe I would like to go in a little bit deep into the next question is actually on due diligence side. I mean, it is actually while this deal close, I mean, COVID have already had an outbreak in the China region or some of the other regions. So did that impact the due diligence process or bring it, etc.?
Yeah. So I think some of the due diligence kind of I think I would say by and large most of it actually could have been done through data room, using the lawyers, the accountants to do it, right? So I wouldn't say that lockdown or not would have an impact on the due diligence. It did have an impact on how we try to celebrate it after. Yeah.
Got it. Thank you. Moving on to the next question, I want to ask possibly to Dex. It's like I understand you're launching a new fund, and throughout this year, I've seen lots of new funds arising, healthcare funds arising in China, and a lot of new fundraise as well. So with the high valuation within the healthcare sector, how has this been, impacting your fundraising?
All right. Okay. So to be clear, we are a traditional brick and mortar business. I echo Wyman when he shared that they are raising a multiple of revenue, but we would love to do that, but every time we raise or we look to raise, it's always it's a multiple of our profits. So on the back of that, because we are a traditional brick and mortar business, and we are very clear on where our focus is. Our focus has always been the patients first, then our doctors and employees. So with that in mind, we have been mindful over the last 12, 18 months that there has been a gradual shift and more opportunities within spaces like what you have shared, biomed, pharma, med tech and equipment. So on the back of this, we are looking to participate as well as to partner this Shenton Fund, which is being built of NUHS, which is the National University of Singapore, whereby they have a CIH, Center for Innovation for Healthcare, whereby deals are being validated through the Center for Innovation of Healthcare. So as a SME or a small and medium enterprise, all we can look to do is to validate deals based on our experience and participate of such deals whereby there is an opportunity to. So from a Singapore perspective, as a SME, we are slowly pivoting, and we are mindful that even though our focus has all along been brick and mortar service, medical service based, we are looking for opportunities at a fundraising stage to build a fund of the brand of the Singapore brand, which is NUHS as well as CIH. So on that note, we have also we have also partnered with boutique fund houses like ICH Capital, who have grown within Singapore itself. And from there, we're looking to raise a 50 million venture fund to participate within deals that are more venture based.
Got you. What the advice that you will have in terms of for the startups, since you're setting up a new venture fund?
I think advice for startups, I think Wyman would be able to give a lot of advice because Dr. Anywhere started and have grown such presence within Singapore and the region as well. So I think for us, what we are looking at, of course, is at the POC or proof of concept stage. But I think the challenge is always the commercialization. So on that note, I think there is a lot of industry experts that has to come in, not just the fundraisers, not just the capital, but really the industry executioners and experts. Because in this market, I think, or at least we feel, that the execution is 100% key.
Great, thank you. So maybe I would like to move on to Dr. Yadavili. Since you're the top 5 hospital chain globally, I mean, I'm sure there's a lot of stories that you can share pre-COVID and now from a patient, government, and operator perspective, and some of the challenges that you may see and face.
Thank you so much, Mr. Trudeau, and thank you, Mr. Lim. Thanks, Mr. Dax. You know, there are a lot of learning points from whatever you spoke. So I've written down, those points also. Starting the way the hospitals function in India, especially, when we started Apollo Hospitals in India way back about 36 years ago. This was the first corporate hospital in India, and people are used to a free medication, free medical services in India because it's a state subject. So when we started hospital chain, and when we started our first hospital in India, we had the millions of problems. Actually, we used to say that, if we have used 1 million bricks to build the hospital, we had 1 million problems also. Each brick had a problem actually when we started this hospital, because the acceptance as a corporate hospital, the accessibility, all these things were a major problems in those times. Then, we slowly grown, and we explained the concept. We could able to understand what is the demand supply issues. Then, we had accessibility issues like, the geographical accessibility, economical accessibility. So we could able to understand that and, address those things. If you are looking at a pre-COVID and post-COVID, what has happened in India or in the healthcare industry. In fact, this is very common, I think, across the globe. the pre-COVID, most of the hospitals, people like major hospitals used to do a lot of multi-speciality work. And it's a direct patient-doctor relation. Patient used to come to the hospital and do the surgeries, multi-speciality surgeries or high-end surgeries. This has, the COVID has led us to use more and more technological advancements. As Mr. Lim said earlier, that the telemedicine has become a major thing at this point of time. People wants to connect, from their homes, to the doctor and talk to them and understand, whether they should really need to come to the hospital. Remote sensing equipment have become very more relevant at this point of time. We basically started this hospital pre-COVID, started emergency services. Then we looked at multi-speciality. We looked at all these things. But during the COVID period, though most of our hospitals are full and overfull, actually, we have more than the capacity. The bed occupancy rates are very, very high. But we were doing more of the COVID treatment and less on the multi-speciality, unless it is an emergency. We were not doing it. But the best part of the story, in fact, if we are really looked at the post-COVID, we learned, how do we manage our patients. They don't have to come, but most of the things, the telemedicine has improved, the home health care has improved, the devices have improved. Then now what we are seeing is after COVID is coming down, in fact, it is very less in India now. People started coming to the hospitals. People started, getting their surgeries done. But at the same time, these learnings which have happened during the COVID time has helped us to make sure that, we have a minimum stay in the hospital patient, but, we manage them across, across the facilities, across the systems, by using telemedicine or home health care or tele-EICU facilities. So this is something, which is very, very innovative in the medicine. But, I just want to end whatever I am saying at this point of time very clearly is that medicine is something which always should have an emotional connect with the patient. So we cannot replace a doctor, we cannot replace a nurse, we cannot replace a technician, or we cannot replace a frontline worker in the hospital by any of the technology. Technology will improve, enhance the experience, definitely. But at the same time, if you are looking at an investment, yes, we need to invest in technology, but we need to invest in manpower very, very clearly, because healthcare works with that emotional connect. So have I explained enough, or you want me to say anything else?
Thank you so much for the answers and everything, and you're sharing your opinions. I think we can, since you touched on the topic of technology, I think it would be great if we can just go slightly deep into the technology aspect. What kind of technology have you been seeing? Especially, it's generally locked down globally in a lot of the places. How has technology helped within this process? And I'm sure some of the other panelists can comment on that afterwards as well.
In big time, Mr. Toto, I think remote monitoring systems have worked very, very well during this particular time. EICU is another thing, which we could able to establish in various of our villages and all, where patients required to be monitored in ICUs, and the manpower is less during this COVID time, because during COVID time, what happened is, a lot of people got infected, the doctors, nurses and all, they gone into the quarantine mode. So we had to invest, we had to get into a technological based services also at this point of time. So EICU has worked very, very well, where in the remote areas, the patients in ICUs we could able to manage. AI played a very, very significant role, and that's a great investment which is happening going forward. AI is something which is in cardiology, AI in healthcare, health checkups area, preventive health, which is in a big way which is happening. The other thing what actually worked and we are actually thinking is the open innovation models. Because this is one more learning, how do we manage patients at various levels? During COVID time, this is another learning which has happened. So we are looking at more of open innovation models, like, more collaborative work which happens with the technology, without technology, with the people, without people. These things are happening in a big way at this point of time.
Thank you so much. Does any of the panelists want to comment on this? Technology, innovation technologies, within COVID pandemic? Possibly, Daniel, is there anything that you would like to share?
Yeah, sure. I can. Well, basically, I can give an indication of what we have been doing in the tech space, and really around maybe our journey into blockchain. So, we started on this journey a couple of years ago, and I guess blockchain's been a bit of a hype over the past decade, but the trend now seems to be kind of enduring. I think it looks as though it's it's got an important place in not just supply chain, but also in healthcare itself. And so what we're starting to see is, industry participants, from manufacturers to last-minded deliverers, have started to enroll in shared blockchains. More players are adopting it, and we're seeing these highly fragmented supply chains kind of now coming together and the associated benefits with it. I guess traceability, transparency, and the need for a single source of truth. Maybe if you look at a raw material, a drug, to see from its provenance to its end of life, the product's end of life. I guess those are kind of really what's driving it. And so, from Zuli's perspective, what we try to do is really launch something that we've called Easy Tracker, which is kind of a blockchain-based application, first in Asia. Really, to allow a patient to be able to track the product's origins and the authenticity by scanning a code on the packaging, and be able to kind of get a degree of guarantee that the product or the drug that they're about to take is either a genuine drug, it's been through a supply chain, it's been through the right conditions, and you can take it with a degree of confidence. And so this is what we've really been trying to do, is really empower the patients to be kind of at the forefront by using technology to be able to kind of better their health outcomes by taking their products. And so with Easy Tracker, what happens, they can scan a product. If there's an issue, Zulu Pharma, the medicine manufacturers, the authorities, they are told immediately, and then you can then go and do something about it. And obviously this is something that's live. It's not what we're talking about as a POC. It's in Hong Kong, Philippines, Thailand, ramping up for COVID-19, because we expect there's going to be a huge amount of counterfeits flooding the market when COVID-19 vaccines hit the actual market. But that's just one use case that we're looking at. Another one that I think is very relevant is really using blockchain technology to underpin EHRs, or electronic health records, and by able to store these kind of huge volumes of data, but also to be able to basically it's obviously a risk. So if anything ever happens to that data, anybody accesses that data, there's obviously huge consequences in that. So to be able to underpin that with blockchain technology, to make sure that only verified users are accessing the data or not, as can control it, gives it kind of a much bigger degree of confidence that we're using the tech in the right way. But that's just to give an idea of some of the things that we've been looking at from Zulu Pharma's perspective.
Thank you, Daniel. Maybe Wei Moon, since we've been talking about new technologies, it's like, are there any new technologies that you think, in the COVID environment that is, your firm is particularly looking at, or you think there's a good future?
So, what was the question again? So it was cutting off a little bit between topic.
Yeah, on new innovation technologies within COVID.
Right. Yes. Sorry, I get it. Sorry. What was the question again? The question was that
new technology innovations within COVID. Is there any, since you guys are on Doctor Anywhere, you guys must have a lot of new technologies or things that you guys are looking at the same time.
I think just to gel in with Dr. Subramanian, right? He mentioned something along the line of doing patient remote monitoring systems, right? So I think going forward, um, so telehealth as a business, it's kind of a laying the pipeline, across the healthcare industry. So at the end of the day, it's about building that connectivity, right? There is the innovation, right? It's not within the pipeline itself, right? But the enabler of the pipeline, right? So things like, for example, like I mentioned, the remote monitoring systems, IoT. This would be, I think, very interesting. Go next stage for all health tech or telehealth service provider going forward, if you ask me.
Yeah.
Gotcha. Thank you. Moving forward. Sorry, Dr. Edwardi, you're trying to say something?
No, Mr. Toto, I'm so sorry. I'm so sorry, Mr. Kennedy. I'm very sorry. I'm actually interrupting. Mr. Toto, I just wanted to understand. I'm seeing some question and answer questions on the this thing on my computer. So should I answer this now, or you will go through those questions or randomly,
Q&A.
whatever you want?
Yeah, the Q&A will be at the back of the. Yeah.
Okay. Thanks, Mr. Kennedy, allowing me.
No worries. I just wanted to comment a little bit on the technology development at the earlier end in terms of developing new therapies and vaccines. And, a lot of companies around the world have really changed the way they're thinking or readjusted their priorities to try to meet either treat COVID-19 or develop vaccines for that. And just as an idea, in the longevity sector, there's several drugs that have been reported to slow aging. I've seen at least one paper now saying that all of them would be good for preventing or treating COVID-19. And to me, I feel like, when it's kind of the opposite of the old saying, now we have a situation where when everything looks like a nail, everybody thinks they have a hammer, And so I think that COVID-19 is definitely changing a lot of the thinking of companies, and it's leading to a lot of new ideas and innovation, but it's also maybe causing some companies to lose focus. I mean, you have 150 companies trying to make vaccines right now, and not all of those are going to be successful by any stretch of the imagination. So, but the other thing I would say is that, in the research sector and in the private sector, when something like this arises, everybody jumps on board, and then when the problem gets solved, everybody jumps back off board. And I think now we probably wish we put a little bit more effort into understanding SARS better, into developing vaccines for SARS that were effective, because that would have taught us a lot about how to deal with COVID-19, even though it's a different virus. I think that there's a tendency with a new pandemic like this for people to jump in too quickly, and then there's too much involvement, and then when the problem gets solved, everybody jumps out of the game, and we lose a lot of the knowledge that was being developed. So hopefully there can be a little bit more of a smooth sailing as we go through this process.
Thank you so much, Professor Kennedy. Do you have, since, the COVID, it has actually accelerated quite a lot of different, directions in terms of like research, cure, and technologies, as you mentioned, but are there anything noticeable that you would like to specifically highlight, or, you think will have a great future in the coming year or remaining next year?
Well, one thing that I would say is that it's really there's a lot of new strategies now to make vaccines, and as opposed to some of the standard things that have always worked in the past would take a longer period of time or cost more. And so this is going to be a real test case for that. RNA-based vaccines, stem cell-based vaccines, all of these things are being tested now, and it's going to allow us to compare and contrast where, what works better in the context of the same disease. So that should be interesting. I do want to also come back to this concept that we always miss the boat in terms of not paying attention to aging. The aging is the biggest risk factor for complications and mortality due to COVID-19. That's not unique to this virus. That's true for influenza and all kinds of other infectious diseases. As I mentioned, it's also the biggest risk factor for many chronic diseases. So in the US, when COVID got bad, they allocated $4 billion to the National Institute of Health to do research. The National Institute of Aging, which is one component of NIH, got zero. And so I tend to think that we still have this mindset where aging is inevitable, there's nothing that can be done about it. But it's clearly not true. And all of the animal model studies that have been done over the last 3 decades, it's been possible to significantly slow aging. And when you do that, you get the animals that are healthier, disease-free, more functional longer. And there's already a number of indications that some of these strategies will work in humans. And so, if we can validate these strategies, and they range everything from lifestyle modification to the supplements to drugs to more high technology things like stem cell therapies. If we can validate that some of these things actually keep people younger and healthier, that's a huge savings the next time a pandemic comes along. So this is not COVID-19 specific research, it's research that's going to impact practically any virus that comes along. And I think that the important thing is that we need to focus on doing better prevention and actually working with people while they're still healthy to keep them healthy longer, because the economic impact of that is huge.
Thank you, Professor. I see, a lot of people start talking about like sick care versus healthcare. I'm sure you can comment a lot on this area. Your views on that, please?
Yeah, I think that, I can comment specifically. I've been in Singapore 3 years, and Singapore is a pretty efficient healthcare system compared to the country I came from, the United States, which is a broken system where 19% of GDP is spent on healthcare. And one of the things I noticed there when we were trying to develop things to keep people healthy, which are essentially preventative medicine, is that even if you had the perfect prevention, it would be hard to make money off of it or get it into widespread use, because the incentive systems around healthcare are very disordered in the U.S. People are not paid by doctors are not paid by keeping people healthy; they're paid by procedures usually. The insurance industry is a very complicated thing, and even pharmaceutical companies, their method for making money is waiting till people get sick and developing treatments to treat them, cure or prevent the further complications from those diseases. So we really need a change of mindset if we want to go to true, what I would call, healthcare. And don't get me wrong, we have to treat disease. If I get sick, I want to get good treatment. I'm not trying to say that caring when they're sick is wrong. What I'm saying is we're not paying enough attention into how to revamp the healthcare system so that we can focus on keeping healthy longer. Because with up to 30% of Singapore over the age of 65 soon, the solution can't be to just keep building more and more hospitals and senior centers. We need those things, but we need to have better strategies that are more economically favorable to allow people when they get older to stay healthy, keep working, keep contributing, and then empower them to do good things in society, rather than right now, which is, most people over 65 have multiple chronic diseases, and they're a cost to the healthcare system. And if they have dementia, they need a caregiver too, which adds another person into that. I think we need a better balancing of sick care with healthcare.
Thank you, Professor. I think moving on to the next question, I think is kind of like, I want to ask, what is the next big opportunity in the healthcare sector, or who is going to be, or which area will be the next Google in the healthcare?
You want me to answer this, Mr. Toto, or is it specific to anyone?
I think anyone can jump in if you ever will. please.
Yeah. So if you allow me to do that, for next couple of minutes, I think I completely agree with Professor Kennedy what he spoke about the preventive health care. Actually, this is one very big area where, as responsible hospitals and medical healthcare professionals, we need to invest more into preventive health, because COVID, no COVID, basic issue is there is a huge burden on NCDs, non-communicable diseases. So unless we address that, how we can be more healthier, rather than how we can build hospitals, I think we need to look at how do we make people more healthier, how do we make this preventive health is more successful model, so the disease burden can be reduced. Otherwise the disease burden is so high by NCDs. In fact, we keep telling, during the COVID time also, people started neglecting diabetes, neglecting hypertension, neglecting heart attacks, neglecting strokes, because they are so scared that when they go there, they get the COVID. But this is not true. What is true is that you need to prevent. We need to lessen the disease burden. This body is, somebody calculated recently, they said it is $6 trillion worth. So it's a very priceless uh, body we have in. And I think God has created one of the best innovations in the human being, actually. So we need to protect this. We need to do a preventive healthcare much higher way. We started in just as an example, I'm just giving because it's my personal experience. We started something called Pro Health. The Pro Health program is nothing to do with any of the high-end surgeries we do and all. We say that please take your checkup, prevent diseases, address them before it evolves into a major problem. We are using AI also into this. So we started getting into it, and as a responsible organizations, I think that is the move forward for us to make sure that preventive health is something which is very important.
Thank you so much, Doctor. Conscious of time, I think we can move into the Q&A session. So we have got quite a lot of questions already. Maybe I'll just start with the first one. As life starts returning to possibly and hopefully pre-COVID times, do you see a gradual warning of healthcare service? How do you see these evolving going forward? Anyone would like to comment on this?
See, as I said, I think the pre-COVID conditions are already started coming into the system now. We started treating more and more patients, more multi-specialty patients. But the learnings are very good. As I said, I think those learnings which we need to be using even post-COVID, and we should very quickly come back that that prevention is very important. The technology is important, so that we can do less movement of a patient, and we should be able to address disease burden in more effective way. I think COVID has given us a lot of opportunity to understand these trends in the world now.
Right.
Yeah,
Thank you.
And I think maybe I'll just chime in, right? From a health tech service, possibly from a telehealth service standpoint, just doing a video call the doctor, visit from home. So I think you possibly would not see the same type of growth, aggressive growth, and of adoption rate of quote unquote health tech services, as if I may get it right in your definition, right? I don't think you can see the same type of growth. In fact, I think that could possibly be even a a reduction in terms of people kind of going back to because of people going back to physical visits. But I think the key here is really trying to understand how the existing player, what they can do to keep the users on the platform, right? So a lot of people, they have not tried it before. After they tried it, they, okay, it's not too bad, right? So what is the, the repeat user rate that keep coming back, to do a virtual visit? I think that would be key. Right? Based on the numbers, we have not seen a decrease in number yet, right? In fact, the online virtual visit number is still going up. So that's something that we do take part in. And we do think that going forward, we don't expect the same type of growth, but we still expect there to be growth.
I agree with Mr. Lim. Actually, the online consults are very, very huge now. They are growing like anything. In fact, we use a lot of aggregators, health aggregators. But now we have seen that there is a great opportunity to start our own online portal. Something called 25/7. So we added a lot of things in that. A lot of people come on that. They upload their reports. They talk to the doctor. That portal is connected to home health care. So somebody visits them if they want. A nurse goes to their house, a doctor goes to their house, a physiotherapist goes to their house. Blood parameters, a technician can go there and draw the blood. So it's a great innovation. Actually, I completely agree with you, Mr. Lim. I think, yeah, you opened up a very, very correct discussion.
Yeah, and don't get me wrong, right? I really do not think that based on the current tech limitation, there will definitely not be able to replace inpatient visit, right? I mean, in-person visit. It's not possible today, right? But I do think that it's possible to have a change in behavior, right? It's a little bit like before Ola, before Grab, before Uber, right? Your first instinct when you want to get a Grab cab, you will be going downstairs to try to flag one down. That was your first instinct, right? Or you call for a taxi, right? But these days, I think most people, I would say that it's reasonable to say that our first instinct is to go to an app to order for a cab, right? So same thing for when we think about telehealth, right? We are not hoping that there will be no more taxi, right? No, right? We're not hoping that there will be no more hospital or whatever. But in the next visit, should there be a straight to in-person visit, or can there actually be, the first instinct to be, why don't I just have a quick a virtual clinic check with my doctor before I visit him in person, right? If there's a need to.
First of all, if you can flag down a taxi in Singapore, you've got better skills than I do. I could never. But I think there's no doubt that it's caused a lot more people to get comfortable with telemedicine and with communication. I mean, my president, soon to be my former president, hopefully, called this the China virus, and it wasn't. It's the Zoom virus. I think Zoom created the virus, really. I mean, because so many people now are used to using these things, and I think that's particularly useful when it comes to things like preventative medicine, because when people are sick, they'll go to the doctor. But getting them to go to the doctor when they're healthy for checkups and getting them to communicate regularly with healthcare professionals is a much bigger challenge. And so I'm hopeful that this will, nucleate sort of a longer term relationship between people and their healthcare providers, particularly when they're still healthy and they're looking at how they can modify their lifestyle.
From a service provider standpoint, I fully agree also with Dr. Subramania, because human beings by nature are things very short-term things, right? So when this pandemic has appeared, there's always a fear that catalyst that from offline to online telemedicine might not be as disrupted as we feel or we hope it to be. So I think it's important to segregate what is primary care and what is also specialist care. And because healthcare is a very contact by nature, very contact physical sport, there is still a need to see face to face and actually interact with the practitioner who's actually treating you. So our hope is really also that this event serves as a catalyst, and the different touch points that we have can serve as reminders to patients that, hey, don't just visit us, you can actually visit a telemed platform and you can follow up from there as well.
Thank you, Dex. Moving to the next question, how do you address the online download of blockchain if the hospital were to switch from traditional healthcare to digital healthcare? And also the next question is also similar in this area. How are the healthcare organizations and hospital using blockchain and AI to address counterfeit products?
Maybe I can take those two questions and try my best to answer them and give a perspective of what we are trying to do in that space. I guess the first one, well, maybe if I answer the second question first, this is something that we're trying to tackle, and basically, I think one of the problems in Asia is that serialization is not mandated at the moment by many governments. You take Korea out of that one, but every other government has not mandated, as they have in the US and Europe, that there needs to be a serialization of all drugs. So it's very difficult to be able to guarantee drugs are genuine if they are distributed at a batch level, and you don't have the ability to say, where did this particular package of drugs go and who are they given to. And we are trying to change that, and we're working very closely with the manufacturers, as well as doing steps in our processes, in our distribution processes, to make sure that we have full granularity of where each drug is being distributed to, and the person who took the drug is the person who should take it, and we can scan it and you can guarantee it. But even if you have serialization in place, it still doesn't. It's still only one piece of the puzzle. I guess if you take Korea, for instance, the things that happened over the last couple of weeks there, serialization, you can guarantee it's a genuine product, a genuine flu vaccine, but actually the conditions that drug was stored in, nobody could guarantee. So maybe they weren't stored in the right temperature control, and this led to unfortunately, there was a number of deaths of people being vaccinated against it. So then how do you start to bring in extra guarantees along the supply chain to actually say, okay, it's a genuine drug, and we can guarantee that through IoT that the drugs were stored in the right temperature, so we can give them a kind of quality stamp as well as an authenticity stamp. So these are all the things that we're trying to do from a pharma kind of distribution standpoint, as well as if we take the other side of what you can use blockchain for. I guess the holy grail would be that you have an EMR or EHR record that is backed under blockchain. The patient can pick that up and take it anywhere they want. They can authorize only people that they want to be able to see that particular record. That is a long way in the future. We're nowhere near there yet, and being able to kind of bridge that gap and to give a degree of confidence that people can be in control of the data, and people can only see it when they're authorized to see it, I think is something that will take a little bit of time to kind of overcome. But these are the kind of things that we're sort of looking at the moment.
Thank you, Daniel. Last question. And this is going to be an interesting one and a little bit tough one as well. I like how one speaker mentioned their orders of priorities: patient, doctors, employees. Sadly, often we see in healthcare that shareholders, etc., is the highest priority, and patient wellness falls in priority. But this is not just unethical, but opposite of sustainability. Hope this perspective change become more prevalent in the healthcare community. Any comments?
Yeah, Mr. Toto, I think I should take this question. I've seen on the this thing that I think Ms. Supriya has raised this thing. I completely agree with you, Ms. Supriya. You know, this is something very important, that hospitals have to be patient-centric. First priority for any hospital has to be only patient. If we have to treat patient very well, we have to have a great employee, whether it's a doctor, nurse, or anybody. So our investment has to be towards employees, towards the doctors, towards the nurses, and hospital has to be patient centric, and the entire service, entire thing should revolve around the patient. Then that is a successful hospital. I do agree with you that there are some areas, pockets, which we keep hearing across the world that there is some unethical, something happens and all, but that's not the majority. What is very important is, I think we need to get into a system where, and we are already in that system, that patient is the first for anything, and then everything will fall in place. whether it is technology, whether it is service, whether it is anything. I think everything need to address the patient needs, and that is the most successful model anywhere. And that's how we started, and that's how the major chain of hospitals are surviving, because of they feel that patient centric is the key mantra, key word for any organization of healthcare.
Thank you, Dr. Yadwali. I think that's a wrap up. So I'd like to thank you all the panelists in sharing with us all this very insightful and of your experience and your views. And I really hope we can beat the COVID soon and business go back to normal. And again, thank you for all the audience in joining this session, and have a great day, and we enjoy the remaining sessions of today.